Hello, my name is Dr. Dewan S. Raja. Today I will discuss about transposition of great arteries. What are the great arteries? These are the ascending aorta and the pulmonary trunk. Transposition of great arteries, TGI, is a serious congenital heart defect. Incidence is 1 in 3,500 to 5,000 live births, in which the two main arteries leaving the heart are reversed. Normally, the pulmonary artery, which carries blood to the lungs to pick up oxygen, arises from the right ventricle, while the aorta, which supplies oxygen-rich blood to the rest of the body, arises from left ventricle. In transposition of great arteries, these arteries are transposed or switched, meaning the pulmonary artery arises from the left ventricle and the aorta from the right ventricle. So the most common type is the dextro transposition of great arteries. This is the more common form and involves the aorta coming from the right ventricle and the pulmonary trunk coming from the left ventricle. In this form, oxygen-poor blood is circulated to the body, while oxygen-rich blood is circulated back to the lung, leading to severe cyanosis. There is blue coloration of the skin and mucous membrane, and low oxygen levels in the body. So this is a normal circulation. This is the right atrium receiving superior vena cava, inferior vena cava. Blood is going from right atrium to right ventricle to the tricuspid or right atrioventricular valve, and the blood, deoxygenated blood coming out by the pumping action of right ventricle to the pulmonary trunk to the pulmonary artery. This is pulmonary trunk, this is pulmonary artery, one branch. This is the left pulmonary artery, this is the right pulmonary artery. So this will go to the lung for oxygenation, and blood will return back by pulmonary vein. We have four pulmonary veins. I'm seeing here two, another two is hidden here. The oxygen blood from the lung will come to the left atrium, then through the left atrioventricular valve or mitral valve or bicuspid valve, it will go to the left ventricle. From left ventricle, from left ventricle, by the pumping action of left ventricle, blood will come out through the ascending aorta, arch of aorta, descending thoracic aorta, abdominal aorta in this way. But in case of this is normal. In dextro position, in dextro type of transposition of great vessel, we look at that aorta, the ascending aorta, arch of aorta, ascending aorta is coming out of the right ventricle. It should not. From ascending aorta should come from the left ventricle. And here we are seeing it is coming from right ventricle. The pulmonary trunk is coming out of the left ventricle. Okay, this is just reverse to that. Okay, we got that. And we are looking another type, levogastro. There is the levo transposition of great arteries or congenitally corrected transposition of great arteries, of a rarer form where both the ventricles and great arteries are switched. Here, ventricle and great arteries are switched. Circulation is relatively normal, but over time, complication like heart failure or valve problem may arise. Okay. Here, aorta is coming from here from the right ventricle, and pulmonary trunk is coming out here from left ventricle. Okay. This is the right ventricular wall here is very thick, and left ventricle wall is abnormally thin here. So what happened? Both the ventricles and great arteries are switched. Okay, that is the difference from the dextro type. In dextro type, arteries will be switched, but the ventricles will not be switched. Here, ventricles are switched. The right become left, left become right. Okay, ventricle. And our aorta coming from the right ventricle, pulmonary trunk, aorta coming from the right ventricle, pulmonary trunk is coming from the left ventricle. What are the symptoms of transposition of great arteries? Symptoms of cyanosis, bluish skin, especially in newborn, bluish because of deoxygenated blood, shortness of breath, dyspnea, poor feeding, failure to thrive. How to diagnose? Diagnose by means of echocardiogram, which is the most definitive tool used, that is used. Okay, this is the diagnosis here. Diagnosis, we got diagnosis. Diagnosis is, okay, diagnosis is done mostly by the echocardiogram. This is the most definitive tool used for diagnosing the transposition of great arteries. We can do chest x-ray and electrocardiogram. This can provide additional information but are not definitive on their own. So best method of diagnosis is echocardiogram. Okay, it may be transvaginal echocardiogram, baby in the mother's uterus. By the transvaginal route, we can go through the echocardiography of the baby, of the fetus. Okay, so we got that. Now try here. This is the chest x-ray. It is not very much acceptable, but in adult or the day passes, someone has uh, levo type of transposition of great artery. It may be useful in the as the age advances, but it is a disease of the newborn, so longevity is not long. And if we do, these are the x-rays of the babies, of the infants. So in this condition, because of X-ray, there is chance of radiation. Okay, here is the egg type heart due to the transposition of great arteries. We'll get there. Okay, the egg-shaped heart here. Here's the egg-shaped heart. And ultrasonography is here, left ventricle, right ventricle is dextro type. So from left ventricle, what we're getting pulmonary trunk, right ventricle, we're getting what? Aorta. So ultrasonography can be done transvaginally to the fetus. Treatment prostaglandin E1 infusion. This medication helps keep the ductus arteriosus open, a blood vessel present in fetuses, allowing some mixing of oxygen-rich and oxygen-poor blood. Balloon atrial septostomy, a temporary procedure done to improve mixing of blood by creating a hole between the heart's upper chamber. So there will be a hole is made in the interatrial septum. Surgical correction, arterial switch operation is the most common procedure for dextro transposition of great arteries. It involves switching the great arteries to their correct position, typically performed in the first few weeks of life. Early intervention is critical. This is the prognosis. And the prognosis depends largely on how soon the condition is diagnosed and treated. And that's all about the transposition of great arteries. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe. Have a nice, wonderful, and blessed day. Bye now.